100 million doses of the Johnson & Johnson COVID vaccine. The deal meant to ensure that the U.S. will have more than enough doses to inoculate every adult in the country. But why has Biden decided on Johnson & Johnson as opposed to Pfizer or Moderna? Joining us now to discuss, CEO of GeoVax, David Dodd. And I also want to throw this at you, David. I don't know why they chose it. He chose that. I don't know if you have any insight on that at all. But how hard is it now, once you get that vaccine, to get it out there so that everybody can get it?
Well, first of all, I think it was selected because it does provide the single dose and less refrigeration. So from a distribution logistics type of standpoint, it basically is a big step forward for us. So it can be delivered with simplicity, and people don't have to come back for a second dose. So I think it makes a lot of sense to also increase the orders for the Johnson & Johnson vaccine.
What about
go ahead, I'm sorry.
I'm sorry, David. I was just going to say, jumping in, I have to get that opportunity. What about all the people that have a problem with taking the Johnson & Johnson vaccine?
Well, the people who are concerned about it are usually coming saying, well, it was only 72% effective versus the 94, 95% that we saw with the Moderna or the BioNTech Pfizer product. And I would point out that comparison is really improper and is really a disservice to allow that information to stay out there. The primary goal of providing a vaccine against COVID-19 is to reduce or eliminate hospitalizations and deaths. And the Johnson & Johnson vaccine was 100% effective against hospitalizations and deaths. I mean, you can't get any better than that. The 72% efficacy compared to the 90+% of the other two is really apples and oranges, because the clinical trials of the J&J study were in a much broader, more diverse population during a time period in which variants had already started to emerge. So it really is not a proper comparison, and they were much more rigorous on how they defined whether or not the COVID virus was evident or not. So I would argue, and I would urge people to look at the hospitalization prevention and the deaths as the measure, and that was 100%. As I said, you can't get any better than that.
So how does it get out there?
How will it get out there is they'll put it into the standard distribution systems that'll go through their wholesalers and their distributors, and they'll probably get it shipped out and delivered to pharmacies and doctors' offices. It'll be much easier to get it out there once it's produced, because you're not dealing with the extreme refrigeration. So it'll be like a standard vaccine, annual flu vaccine distribution.
Wow.
The biggest challenge will be ramping up the manufacturing. What is going to have to be done is that the methods and materials, so to speak, of manufacturing the J&J product need to be transferred to, like, Merck, who is assisting them on it. It has to be validated, implemented, and then they will then go forward with it. But that'll be the biggest challenge, quite frankly. Once this product is manufactured and then finished, filled, packaged, it's going to be able to go into a supply chain process much simpler than the other vaccines.
All right. Well, let's hope so. David Dodd, always great to have you with us.
Thank you.
All right.